Good evening, everyone. Welcome to our LAMP-CA assessment, Module 2, Week 4. We will continue with diagnostics. Let's start with number 1. I would like Ma'am Angel Ko to take care of questions 1 to 5. I'm sorry about my voice. I think it's the very bad weather in Manila. So, yan. I miss the place where I stay. Mas maganda boses natin doon. Okay, let's start with number 1. Can we call on Ma'am Angel? So I think this is a case, a case study. Ma'am Angel? Dito ba si Ma'am Angel? Ma'am Angel? Oh.
Okay. HIV positive. Yes po. Doc, narinig niyo po?
Opo.
Hello po?
Opo. Narinig po kayo.
Okay, sorry po. Okay. Question number 1. A 43 years old male, HIV positive, patient has suffered from chronic sinusitis for the past 10 years. The sinus infection comes and goes. It is usually induced by exertion or when he catches a cold, which occurs 3 or 4 times per year. He also complains of fatigue and loose stool. He has a pale tongue with a slightly thick, greasy coating and a deficient pulse. Which of the following types of nasal discharge would you expect in this patient? A. Profuse and turbid pus, dark yellow or green-yellow discharge with foul smell. B. Scanty yellow discharge, possibly with blood and pus. C. Profuse watery discharge, alternating between white and green, or light yellow color. D. Profuse and watery. Answer po, Doc, is letter C po, profuse watery discharge, alternating between white and green or light yellow color.
Okay. Can you
Kasi
support?
ganyan din po may sinusitis.
Okay po. Ma'am Angel, can you support your answer?
Yes po, Doc. Apo. Kasi po pag yung letter A po, yung profuse and turbid pus, yung with a foul smell, parang wala namang foul smell po pagka from nose. Yung discharge. Yung letter B naman po kasi, scanty yellow discharge is from heat. Kasi with blood po siya.
Okay.
Yung letter D naman, profuse and watery, parang sa rhinitis naman po siya. So, ang answer ko po is talagang letter C po, yung sinusitis kasi yan, yung letter C, may greenish or light yellow po.
Okay. Kagaya ng sinabi ko last time, pag ganito ka, may mga ganitong klaseng cases, una nating titingnan kung binigay is the tongue and pulse, no? So, I'm sure na-remember niyo po, Ma'am Angel, yung 8 principles for diagnosis. First, you need to identify ano ba yung problem natin. Is it yin or ang pasyente ba yin or yang? Diba? We identify whether the condition is exterior or interior. Okay? Is it hot or cold? And is it deficient or excess? Okay, let's go by that parameter. So, dito muna tayo mag-focus, Ma'am Angel, sa pale tongue, slightly thick, greasy coating, deficient pulse. So, ano po yung ating...
Ano po siya? Cold po.
Cold.
Parang deficient, yung deficiency po siya. Kasi
Okay.
pale siya, tapos thick po yung white coating. So, kung yellow po kasi is heat. So, white po siya. So, more on yun po. Saka pale po yung tongue.
Interior or interior or exterior?
Parang exterior, Doc. Kasi ano na po thick greasy coating
Exterior? Ano ba ibig sabihin po ng exterior? Di ba?
Ay, interior pala, Doc. Sorry. Thick pala is interior. Thin pala is mild and normal. So, thick po siya. Is interior pa lang, Doc.
Interior. Okay, kung exterior po ito, ano po yung posible nating makikita sa dila? Do you expect a thick coating?
Parang Doc? Rootless. No coating.
Matetense na naman tayo. Okay, ganito ha, huwag ka matense. Alam mo yan. Then, huwag ka ma-disappoint. Medyo, alam mo yung sagot no? Okay. Balik tayo sa diniscuss natin last week. I think we've overemphasized the difference between exterior and interior. Di ba pag exterior, pag titingnan mo yung dila, walang pagbabago sa dila, no? Thin and white. But if it is wind heat, do you agree? Pag wind heat, usually may makikita kang red spots sa tip and the sides. Do you agree? Okay. Yung pag kumakapal na po yung coating or napula na po yung gitna, that's the time we say it's already interior. And another thing, based on symptomatology, ano po dapat ba ang mararamdaman ng patient para sabihin natin exterior ang ating problem? Di ba pag exterior galing sa labas? Di ba? Oo, nakalimutan nyo na ba yung yung chills and fever? Simultaneous, remember? Yes. Exterior sa labas pa. Meron kang occipital issues, masakit yung batok mo. Kasi di ba dyan pumapasok yung wind? Do you remember? Okay. So we have a 43-year-old male HIV positive patient. Ibig sabihin, immunocompromised na yung patient. What do you mean by immunocompromised? Meron na po siyang morbidity, no? So ibig sabihin, meron na po siyang chronic issue, meron na po siyang deficiency. Okay? Tingnan mo, chronic sinusitis for the past 10 years. Okay? And it is induced by exertion or when he catches a cold, this occurs 3 or 4 times per year. Kaya yung mga sinisipon dyan parate, tingnan nyo na po yung ating yung health condition, no? Itong fatigue and loose stools, Ma'am Angel, what is this very, very indicative of? Based on?
Is po, spleen deficiency po. Kasi
Okay.
may fatigue po
Very good. Is there a feeling of cold? So spleen chi deficiency, ano pa po? Like pale tongue, that says a lot about the what? Pag may nakita kang pale tongue, would you instantly say it's deficiency?
Ano po, swollen tongue.
Yeah.
And wet.
Okay. Itong slightly thick greasy coating, ano ba ibig po sabihin yan?
Parang po siya, parang may dampness po siya, Doc.
Okay. Ibig sabihin matagal na. Oo.
Opo.
Yung thickness kasi po ng coating will actually tell us yung depth ng involvement ng pathogenic factor. Di ba? Yeah. So amongst the 4 choices, the best yung letter C. Kasi nga, okay, bakit mo nasabing mali yung letter A? Profuse,
Kasi
turbid.
opo, parang may profuse and turbid pus, tapos po, meron siyang with a foul smell. Kaya parang
Pag
mali
may,
po, Dok. Parang,
pag may foul smell, ano po ibig sabihin?
parang infection na po talaga yun. Tapos parang hindi siya discharge sa notes po, sa experience ko po.
No, discharge pa rin siya, pero may amoy.
Apo.
So, pag
Apo.
ito po yung sagot, ano dapat ang makikita mong pattern? Kasi may heat, di ba? It's a combination of yin and yang. Yes, and heat. Remember? So it should be damp heat. Do you see that here? Well, mayroon bang heat signs dito? Wala. Di ba?
Wala po.
Okay, what about scanty yellow discharge? Ano dapat yung diagnosis? Scanty. Kokonte. Diba?
Kaunti lang po, Dok.
So ano dapat yon? There should be what? There could be dryness, di ba? Meron bang tayong dryness dito? There could be heat, no? Heat, kasi blood and pus, di ba? Heat. Okay, profuse and watery. But why did you not like profuse and watery?
Ano po, kasi wala siyang description na ano yung green or light yellow color.
The best answer is letter C.
Yes po talaga, Dok.
Okay. White and green, light yellow color. Kasi makapal na yung coating eh. No? Ibig sabihin, hindi na po ito yung ano pa lang, early stage. Nag-alternate na, white, green, light, yellow. Okay. So yon, that's the way to analyze it. Thank you. Would you like to continue with number 2, Ma'am Angel?
Yes, Doc. Number 2, a 43-years-old female patient was diagnosed with carcinoma of the pancreas. Yan po yung pancreatic cancer. 2 months ago, she has since begun radiation and chemotherapy. Currently, she suffers from the side effect of the chemotherapy, which include fatigue, nausea, vomiting, and anorexia. The vomitus is frequent through only in small amounts. The vomitus contain undigested food and does not have a strong odor. Which of the following pathogenesis is most likely to have caused her current condition? A. Damp heat in the middle burner. B. Stomach and spleen yang deficiency with cold. C. Food stagnation. D. Liver attacking stomach.
Okay.
Doc. Now, ang answer ko po, Doc. Answer po is letter B po. Stomach and spleen yang deficiency with cold. Kasi po, dun po sa may vomiting po and sa fatigue po talagang spleen. Siyempre, spleen po yung fatigue. Tapos may vomiting and nausea po. So parang connected po sa stomach.
Okay.
Hindi po siya letter C kasi food stagnation lang po yung letter C. Yung di naman po liver attacking stomach, pagka nag-attack po si liver sa stomach, dapat po acid reflux and hiccup ang nakalagay po sa description. Kaya letter B po doon ang answer po.
Bakit may cold? Saan dito magsasabi na may cold po?
Yung ano po, Doc? Yung bakit po may cold? Kasi po yung Ano po niya?
Ano po? Okay, isa-isahin po natin.
Yes po.
Dump heat in the middle burner. Bakit mo hindi mo sinagot yan? Yeah,
Kasi po
undigested.
pag dump heat po, parang meron din po siya dapat na acid reflux and reflux.
Cold, acid reflux.
Yes po. So, kaya hindi po si letter A.
So, ibig
Si B
sabihin,
po,
sandali lang po. Pag may
ako,
dump heat, magkakaroon ka ng acid reflux.
ah,
Hindi ba ano yun?
ah,
It's something to do with the rebellious chi of the stomach? Or probably the liver impacting the stomach kasi na-stress ka? Dump
pwede
heat.
po,
Mhm.
pwede po daw.
So, hindi reflux. Reflux, bumalik umakyat ulit.
Ako.
Punta tayo sa
Si
food.
ano po pala, ako. Food stagnation po, hindi po siya, parang hindi naman siya, Doc, parang simple food stagnation only eh. Kasi may keyword po siya na fatigue tsaka anorexia eh.
So, pag food stagnation, walang fatigue?
Meron naman, Doc, pero parang mas best answer po talaga yun.
Ano ba ang nangyari pag may food stagnation? Like,
Parang
paano mo
hindi
masasabi
natanawan.
sa naamoy mo or nakita mo sa pasyente or sa tongue na merong food stagnation? And how do you differentiate that from damp heat in the middle burner?
Si dump heat po sa middle burner po, meron po siya yellow or crack po sa center of tongue.
Okay. Napansin nyo, the vomitus contains undigested food. So when you have a vomitus, it's ano po yung indicative? Is it indicative of the spleen or the stomach? Nag-vomit ka, bumalik ulit, umakyat ulit. So pag may vomitus, kasi in-emphasize, nung nakita yung suka niya, merong undigested food. Ibig sabihin, kumain siya ng malunggay, ganun pa rin yung itsura niya. Diba? So what is that telling us? Are we talking about a very weak spleen or are we talking about a weak stomach? Kaya mo yan, Ma'am Angel.
Weak stomach po. Weak stomach po and
Yes,
spleen.
stomach. Okay. Why do you think and emphasize na walang strong odor? Napansin nyo? Does not have a strong odor. Kung may strong odor, what are we talking about here?
Heat. Heat po pag may strong odor. Cold po kasi wala po siyang strong odor.
So,
Kaya,
which of the options are we talking about if there is a strong odor?
yung ano po, yung letter A po.
Anong kaibahan ng A sa C?
Yung isa po kasi, yung A, damp heat po. Yung B po kasi, deficiency with cold. So, yun ang pinagkaiba po nila.
So, anong sagot mo dito?
Ang sagot ko po is letter B kasi po, does not have a strong odor. So, ang answer po, Doc, is yung deficiency with cold. Kasi pag
Food
damp heat
stagnation,
po,
may strong odor.
yes po, meron din po.
Okay, kasi sinabi mo, yang deficiency yung dalawa, di ba? Ang kaibahan, walang odor So pag walang odor, may cold. This is actually an aggravation of the chi deficiency. Diba? In fact, it's already yang deficiency. Do you agree? Okay, let me ask I hope you don't mind, Ma'am Angel. Alam ko nag-aral ka. Di naman ito revalida. And let's show the others that you are very good. Diba? And appreciate your diligence. Liver attacking the stomach. When does it usually happen? Diba to bosses ko? Okay. Liver attacking the stomach. Okay, my question is, ano ba yung instances? Can you tell me a very common instance when the liver is affected? Pag stress tayo, di ba? Nagalit. Let's say habang kumakain kayo, nag-aaway kayo. Do you agree? And so, what happens when the liver is affected? Will you be able to have a very good chi flow of the liver or not?
Hindi po. Wala po.
So, ang mangyayari, magkakaroon ng liver chi constraint or liver chi stagnation. Very good, Sir AK. Well appreciated. So, what happens when you have liver chi stagnation? Will that develop into heat?
Yes po, Doc.
Yeah, so when it
Ito
develops...
na po yung mag-acid reflux, Doc.
Okay. Bakit? Anong relationship po ng 5 elements are we talking about? Okay. For the benefit of those, sabi ko kasi ang gagaling ng ating mga, okay, I think most of these are, wala akong nakikitang taga Baguio.
I'm here.
Oh, you're here. Okay. Hello, Ma'am Joy. I think you're the only representative.
Hello po.
Are you enjoying so far, Ma'am Joy?
Yes.
Okay,
Enjoy po, Doc.
how's Baguio?
Rainy pa rin.
I miss your cookies. Very, very,
We'll visit you with a
no,
lot of
huwag mo
cookies.
kakayanan naman. Yeah, so I miss your cookies. I hope it's not too damp. Di ba, naman siya, friendly? Anyway, sige, mamaya ng tsikahan. Okay, ganito. Ma'am Angel, hindi ka pa naman siguro nagkakaroon ng liver chi stagnation?
Hindi ko sure, Doc. Kasi may acid reflux eh.
Oh, so nakaka-relate ka. Okay, this is
Yes,
what
po.
happens. The liver is wood element, right? And
Yes, Doc.
normally, the liver, being the wood element, it will control the what? The earth, which is the stomach and spleen. Yes? Yeah. So what happens when there is heat? So there is now over-controlling. Okay, bakit ka nagkaka-acid reflux kaya, Ma'am Angel? Meron ka bang mga, would you mind telling us? I hope you don't mind.
Hindi ko alam, Doc, kung dahil sa spleen po ba eh.
Na-stress ka ba? Meron ka bang mga stress issues?
Actually, wala na, Doc eh.
Okay, so wala ka na dapat reflux. Okay.
Okay.
So affected po. Okay, mukhang na-stress na rin. Mas relax ako pag nakikita yung smile ni Ma'am Angel. Can we proceed to number 3, Ma'am Angel?
Yes, Doc. Number 3 po. A young man woke up one morning to see a patch of hair fall from his head. The night before, he had slept beneath an open window. Which of the following best describe the cause of his condition? A. Blood deficiency with invasion of wind. B. Premature senility. C. Insufficiency of kidney essence. D. Insufficiency of the heart chi.
So what's your answer?
Answer po, Doc, is letter A po. Kasi pag blood deficiency, Doc, magkakaroon ka rin ng insufficient nutrients na magsusupply para sa hair natin.
Okay. Ganito, Ma'am Angel, ano pagkakaiba nito sa kalbo lahat? Remember, patch lang. This is what we call...
Yes, Doc. Yung kasi, Doc, yung parang nakakalbo na lahat. Sa po yun, insufficiency of the kidney essence.
Okay.
Yun po ang ko po. Apo. Tapos yung yung patch lang po, ito po yung, siyempre, pag blood deficiency tayo, yung blood po kasi natin, kasabay po niyan dumalo yung chi, tsaka yung nutrients. So, nagkakaroon po siya ng insufficient, kaya patch lang po yung nawala.
So dapat yung mga maputla, yung kulang sa blood, hindi matutulog beneath an open window. Isara yung window.
Opo.
Okay. Maraming salamat. Correct answer is A. Let's go to number 4.
Number 4. A patient suffer from palpitation, dream-disturbed sleep, forgetfulness, and anorexia. The abdomen is distended and the stools are loose. The patients appear listlessness and has sallow complexion. There are numerous subcutaneous hemorrhage on the arm and legs. She has not had her period in 3 months. The pulse is thin and forceless. Which of the following represent the most likely appearance of her tongue? A. Pale and tender tongue, body with a white coating. B. Pale white coating. C. Pink body with a red tip. D. Pale tongue, body with red tip.
Before you answer, Ma'am Angel, what is your diagnosis?
Ano to? Ang diagnosis based po sa niya, sa pulse niya po, ano po siya, blood, may blood deficiency po siya.
Okay.
Tapos, meron din siyang yung subcutaneous hemorrhage sa arms. So, parang yung blood niya kasi under the skin.
Okay.
So,
Pag
pale din po siya.
nag-diagnose tayo, kailangan
Opo.
sabihin natin ano yung organ involved. From the history, anong organ po ang involved? Or what organs are involved?
Ano po, heart. Heart kasi may palpitation siya.
Very good. So do you think related po itong dream disturbed sleep, forgetfulness?
Yes po. Yes po.
What about anorexia?
Kasi po hindi po na yung na-house yung shen niya.
Okay. What about abdominal distension and loose stools? Ano po ang zangfu organ dito?
Spleen po, Doc. Kasi
Spleen?
loose stool, parang spleen po kasi loose stool po siya eh.
Yeah.
So parang,
So heart spleen.
kaya,
Okay.
kaya best answer ko po is letter D. Kasi pale tongue sa spleen, tapos yung tip is red.
So very
Yung
hard.
heart naman po yun. Yes po.
Okay. Does everybody agree? Okay. How would you explain the subcutaneous hemorrhages sa arms and legs?
Ano siya, Doc? Para siyang...
Sino ba dito ang at fault? Sino ang may problema dito?
Parang si ano pa rin, Doc. Si heart pa rin.
Are you sure? Have you forgotten one function?
Si spleen din po. Kasi may arms and legs yan.
Sabi ni Sir AK, spleen issue. Huwag natin kalimutan yan. Okay? So sabi din nito, yeah. Kalimutan ko. Okay, Shen, restless spirit. Yeah, restless spirit, very Shen. Wait lang. She has not had her period in 3 months. So, kaya dream disturbed sleep because, okay, ano pa ibig sabihin pag walang period in 3 months? Are we talking about, what pattern are we talking about?
Ano po?
Okay, punta tayo sa pulse. Binigay ko lang. Okay, punta tayo sa pulse. Thin and forceless. Payat and walang sipa. Thin. So we're talking about nutrition. Kulang sa sustansya. Kulang sa what?
Kulang siya sa
Blood.
Blood. Yes, very good. Kasi nga walang mensoff in the 3 months, no? So why did you answer pale tongue body with red tip?
Kasi Doc, yan nga po, Doc, parang kulang siya sa dugo. So, una sa lahat,
Okay.
involved ang spleen, tsaka
So,
yung heart.
okay. Bakit mali yung letter C, pink body with red tip?
Kasi hindi siya magiging pink, Doc, eh, kasi blood deficiency siya, eh. So,
Okay, very
yung
good.
blood deficiency, mapakla, opo.
Okay. Isa na lang po, Ma'am Angel. Okay. Kayang-kaya naman eh.
Number 5 po. Number 5. A 20-year-old female complains of chest pain, insomnia, palpitations, migraine, headache, lower abdominal pain, and distension before and during his period, and heavy menstrual flow that is dark red in color, with numerous clots. There is also a mass on her neck. Her conventional medical diagnosis is thyroiditis, which is the most likely tongue appearance and patient will present. So, ano to, Doc, relate na naman tayo.
Oh, diretso tayo sa answer.
Answer po natin is purple red tongue with potecha. Ang hirap i-pronounce na.
Ganito po, makinig mo na kayo. Petechiae.
Petechiae.
Petechiae
On
yan.
the tongue edge.
Petechiae. Masanay na po kayo ha, kasi sinabi ng pitak, tuturuan na kayo ng mga medical terms. Yun ang pangarap talaga ni Doktora Palangka. Di ba excited kayo maging medical acupuncturist? Napainom tuloy. Okay. Petechia. So plural, petechiae.
Petechiae.
Google, ano ibig sabihin yan? Okay?
Purple dots po.
Okay. So, ano natin? Himay-himayin natin. Bakit mali yung letter A? Purple tongue. By the way, anong diagnosis mo dito, Ma'am Angel? You have to have a diagnosis.
Yes po, Doc. Ano po siya, Doc? May ano to, Doc? Parang...
Ayan. Ay, ang bait naman ni Dr. Ryan. Parang... Okay. Dr. Ryan.
Blood stasis po.
Tingnan niyo po yung petechiae, ha? Ang bilis. Yan po itsura ng petechiae. Please check your chat box. Petechia, plural is petechiae. Okay? So from now on, bawal po sa lung ang ma-mispronounce iyan. Pinuputol ang dila pag mali ang pronunciation. Joke. Okay. So, isa-isay natin, Mama. Una-una,
Yes, Doc.
chest pain.
So, heart po,
Pag may
Doc.
chest pain ka, yeah, because of palpitations. Pero ang tanong, anong pattern? Are we talking about heart blood deficiency or heart chi stagnation, heart blood stagnation?
Heart blood stagnation, Doc.
Why?
Kasi meron siyang Doc, heavy menstrual flow, tapos dark red in color with numerous clots. So,
okay. Ano pa? Meron tayong nakitang?
Thyroiditis po, Doc.
Okay, may mass sa neck. Okay, yung may mass sa neck, tinan yung dila nyo. Okay, and pray hard that it's not cancer. So thyroiditis siya, no? Okay, yung sagot nyo po is purple tongue.
With petechiae.
Bakit sa edges ng tongue?
Kasi, Doc, nandun po yung
liver involvement. Alin dito
yes,
po sa history will tell you there is liver involvement?
Yung Doc, yung heavy menstrual flow.
Galing talaga.
Kasi,
wow. So, okay. So, the correct answer is, at saka bakit purple red, hindi bluish red?
Kasi
Ay,
Doc, ano eh.
purple red, hindi, ano ba to? Purple blue.
Kasi Doc, pag purple blue, may cold siya.
Ito,
Ito po, ano, heat.
saan dyan nagsasaad na may heat? Okay. Anyway, thyroiditis. May inflammation. Ano yung ibig sabihin ng thyroiditis?
Namamaga po yung ano, Doc.
Yung ba yun? Ewan ko, mali din siguro ako. Anyone who would like to comment? I might be wrong. Okay. So the correct answer is letter B, unless there are other objections or violent reactions. Okay, maraming salamat, Ma'am Angel.
Thank you, Doc.
Ba? Okay. Okay, from Ma'am Angel, we'll call on another A. Sir AK. Sir AK, good evening. 6 to 10. Kayang-kaya.
Good evening po. Good evening sa lahat.
Good evening.
Okay po. Number 6. A female patient has a history of acute nephritis and duodenal ulcer. For 5 years, she has been symptom-free. However, she still has weakness in the limbs, pale, yellowish complexion, abdominal bloating, poor appetite, shortness of breath, loose stools, and sweating after even slight physical exertion. Her pulse is submerged and deficient. What is the most likely tongue appearance this patient would present?
Okay. Sir AK, before you answer, ano po yung diagnosis natin?
Dali, Doc.
Hindi, sige, tulungan kita. Di ba sinabi ko, tinan niyo yung pulse. Pag submerged ang pulse, tapos forceless or
Deficient.
Yeah. So deficiency na. Ano ibig sabihin pag submerged?
Internal, Doc, mahina.
Okay. Hindi naman mahina. Mahina na talaga, deficient eh. But when you say kasi submerged, not necessarily mahina. Okay. Are you familiar with acute nephritis? No? Ano po yung functional unit ng kidney? Nephron.
Doc?
Functional unit of kidney is nephron. So we're talking about the kidneys here. Acute nephritis. Duodenal ulcer. So meron tayong, yun yung ano niya, comorbidity niya. Symptom-free for 5 years. Pero meron pa rin siyang weakness sa limbs, pale yellowish complexion, abdominal bloating. Itong abdominal bloating and poor appetite, what is this telling us?
Doc, ano to spleen G deficiency, Doc.
Okay.
Tama po ba?
What about shortness of breath?
Shortness of breath is still G pa rin, Doc.
Okay. Kasi tingnan nyo, mayroon tayong keyword, everyone listen. Slight physical exertion. Even slight physical exertion. So ibig sabihin, everything is with an effort. So that is Qi deficiency. Okay, Qi deficiency of the blah, 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 blah. Okay, ano answer mo, Sir AK?
Yung itsura, Doc, ng dila niya is pale. Definitely, Doc, may teeth marks and white coating. Yin condition.
Yin condition.
Kasi majority doc dun sa ano niya nag-appear is Qi deficiency for
Do we
appetite.
have yin condition. Qi deficiency to, di ba? Okay, lahat pale So pale na pale lahat. Puro pale. So bakit hindi mo sinagot ang letter A? Slippery thin white coating. Does the pulse tell that there is, does this connect
Submerged and
what you see?
deficient lang doc eh. Slippery thin white coating. Ano to doc, di ba? Slippery is
Dampness.
dampness.
Do you have
So hindi siya doc.
symptoms here? Ano ba dapat hanapin nating sintomas para sabihin may dampness? Feeling of?
Yung ano doc, mabigat na pakiramdam doc.
Okay, very good. Sa mali na yung letter A. Yung letter C, bakit mali?
White graysy coating. So wala siya doc ano eh. White graysy coating is still ano to eh.
Wala pang
cold.
dampness. Dampness din yan, di ba?
Dampness din doc eh. Cold.
Itong yellow
Damp
greasy
cold.
coating, ano naman yan?
Kabaligtaran naman doc. Ano to eh. Heat. Damp heat.
Okay. Meron ba tayong nakikitang may ano dito? O simple lang? Submerged lang siya. And deficient. Yung ating
doc.
pulse. So, anong sagot? Pinakamagandang sagot. So walang problema pa sa coating. Diba? However, meron ng mga teeth marks sa kaiba na ng kulay. Yeah. So your answer is?
So letter B, doc.
Okay, very good.
With teeth marks and thin white coating po.
Okay, thank you. Let's now go to number 7.
Okay, number 7. The course of channel may present syndrome of the same organ when it is affected. The pathologic factors of the liver, for example, can be reflected by disorders at liver.
So, para malaman mo, tapos ngayon, yung ano mo is may liver issue. Iko-confirm mo yan kung may talaga bang may problema sa liver. Anong kakapain mo? Are you going to palpate the elbows, the popliteal fossa, the axillary fossa, or the hips?
Letter C, doc, the armpit.
Okay, very good. Have you done that before?
Hindi pa, doc.
Sige. Wala pa pala tayong palpation. But anyway, sige. At least, good to know. Number 8, Sir AK.
Okay, number 8. When the spleen is affected, disorders on each of the following areas should not be found, except for the elbows, the B, the armpit, the hips,
The answer is, naintindihan mo yung question? So pag may
when the spleen is affected.
So ibig sabihin, alin dito sa 4 or 5 will tell you that the spleen is affected?
The hips.
Definitely the hips, doc.
Okay, very good.
Nandoon yung ano
Easy. Yeah. Ang alin?
Malapit din sa spleen.
Okay. Sige, gagawin natin mas intensive yung ating channel studies. Okay, let's go to number 9, Sir AK.
Okay, number 9. When a patient complains of ulceration, swelling, and pain of the mouth and tongue, accompanied by insomnia, feverish sensation, flash face, bitter taste in the mouth, and a hot and dark yellow urine, upon examination, the patient exhibit a red tongue and rapid pulse. And the probable diagnosis would be deficiency of kidney. The answer, Doc, is letter C, hyperactivity of heart fire.
Why?
Doc, dito sa binanggit niya rito, swelling and pain of mouth and tongue, may insomnia rin siya, bitter taste in the mouth. So, lahat ito is nagde-determine, Doc, ng heat heart heat or fire
Di ba liver fire meron ding bitter taste?
Yeah.
Sa liver fire kasi whole day may bitter taste. Ano yung nasa history that will exclude the diagnosis of liver fire?
I
Kasi
think,
sagot
Doc,
mo heart fire.
nagre-reflect, Doc, sa mouth and tongue
May sinasabi ba
Tama
dito
po ba?
about that? Liver fire
Face.
Ano yung hanapin mo? Sandali, ubo muna ako.
Palpitate.
Okay. Liver fire, ano yung hanapin mo?
Pag liver fire, Doc,
Tingnan mo yung mukha ng pasyente. Malaman mo liver ka agad. Sinabi niya, may bitter taste.
Doc,
Yes,
sa mata, Doc,
ang galing
nakikita.
talaga. Very good. And when you look at the pulse, sorry, stupid. Sige, bahala na. Kidney insufficiency, anong itsura ng face?
Kidney insufficiency, Doc, is
Yin deficiency yan,
Malar flash.
Malar flash.
malar flash, Doc.
Kalimutan. Anong sintomas ng yin deficiency? Kidney. Di ba? Kidney, low back pain, and
Yes, Doc.
keeping. Ano pa? Hindi lang yun ang symptoms Ang dami kayang kidney patterns, di ba? Remember the night sweats? Night sweats, remember that's yin deficiency. Ano pa? Yung 5-pound heat. You forgot that?
Yung kamay paa, Doc.
Oo. Do you feel thirsty? Would you feel thirsty?
Yes.
Yes, Doc.
Yes. Would you
Deficient
would you drink a lot of water?
No.
No, Doc.
Yes. Paulit-ulit to Okay, what about stomach fire?
Stomach fire. Gutumin, Doc.
Parating gutom, so mag-asto.
Ano siya?
Yeah, totoo.
May acidity. Tawag ito. Heartburn.
Okay. What about, bakit po, sabi mo kasi heart fire, no? Bakit bakit mayroong dark yellow urine pag may heart fire ka?
Heat, Doc. Sobrang init po, Doc
Kasi yung init mag-spill over sa rapid pulse. Sabi ni Dr. Dito good to know. Basahin nyo yung sa group chat. Sabi ni Dr. Ryan, a nephritis, condition in which the tissues in the kidney become inflamed. So magkakaroon ng problems filtering waste from the blood. Okay? Yeah, very good. Thank you very much po. So it's the rapid pulse. Rapid yung pulse niya. Okay,
Yes,
sabihin ko na lang. Nagkaroon ng dark yellow urine dahil nag-spill over na yung apoy ng heart sa small intestine. Diba? Ngayon, ang tanong, bakit small intestine? May kinalaman ba yan sa bladder? May kinalaman ba yan sa ihi? If so, bakit? Can you tell us, Sir AK? Di ba yung
Alin,
heart,
Doc?
the small intestine, pair yan sila, di ba? Far
Yes,
out.
Doc.
Ngayon, bakit may dark yellow urine? Kasi kung
Kasi, Doc, di ba
over-
yung spleen siya yung naghihiwalay ng
bakit tayo
yung
napunta sa
fluid.
spleen?
Ng ano pala, ng small intestine. Na partner ng heart, di
Sino
ba, Doc?
yung ano po yung, paano ko ba sasabihin to? Are you familiar with the greater yang channel? Taiyang?
Yeah.
Yes.
Yes, Doc.
What are they? Sino yung greater yang channel? Taiyang.
Sayang channel.
Oo. Huwag ka ma-tense. Kaya mo yan. Sabi mo nga, familiar ka eh.
Ay, Doc.
Remember, bladder and
Bladder and bladder and small intestine, Doc.
oh, 'di ba? Yun. Ganito nangyari. Tingnan mo, grabe na. May ulceration na sa tongue, swelling, pain, yung mga, ano ba tawag niyan? Mouth sores, no? Nagkakaroon ng mga sugat-sugat sa, meron pa insomnia, feverish sensation, flushed face, bitter taste. Tapos nag-spill over na yung heart, masyado ng yang. So affected na yung partner niya, which is the small intestine. So kasi I find it weird if you say hot and dark yellow urine. But the reason there is because the small intestine and the bladder have the same polarity. They belong to the taiyang. So my
Taiyang.
question is, which one is the hand taiyang? Which one is the foot taiyang? So ibig sabihin,
Taiyang, Doc.
yeah. Sino si hand taiyang? Si small intestine o si
Small
bladder?
intestine, Doc. Small
Yeah, so
intestine,
foot
Doc.
taiyang is bladder. Very good.
Yes, Doc.
So this is how you should look at it. So you're actually involving three channels: heart, small intestine, and the bladder.
Bladder.
Very good. Now let's go to number 10, the last one for Sir AK.
Okay. Which of the following symptoms could be indicated of points on the large intestine, small intestine, stomach, and kidney channel, and common? Following symptoms could be indication of points.
Your answer is
Diarrhea, Doc. Letter D.
paano nagkaroon ng diarrhea pag stomach? Kasi yung stomach, partner niya si sino partner ng
Doc?
stomach?
Spleen.
Yes, very good.
Loose
What
stool,
about the kidney? Bakit kailan magkakaroon ng diarrhea pag may kidney issue? Anong pattern?
Kidney yang, Doc.
Ang galing. Wow, grabe. You know, I'm so proud of you. I'm so like, pinagyayabang ko kayo lahat. No? I think, yeah. Maraming salamat, Sir AK. Hindi ka ba na-stress o gusto mong ipatuloy pa lahat? Joke. Maraming salamat, Sir AK.
Thank you, Doc.
Good job. Both
Thank you,
Sir
classmate.
Ma'am Angel and Sir AK, you did well. Bawal po dito magkamali. Oo. Pinuputulan ng isang daliri pag nagkamali. Okay, so let's go to number 11. Oh, let's call on Ma'am Ami na nawala na yung nervyos. Ma'am Ami, good evening. Yan, ready na yan. Hindi na yan natatakot. Can you take care of 11?
Number 11, an exterior syndrome can be differentiated by the presence of A, tidal fever, B, high fever with aversion to heat, C, alternating chills and fever, D, chills and fever, E, chills without fever.
So, answer.
The answer is letter D, chills and fever.
Okay. Bakit may chills and fever on exterior syndrome?
This is a acute condition.
Di ba pag may chills, ibig sabihin, kasi the presence of wind will actually affect your weight shift, no? So, it prevents actually your upright libido. Kaya, nawawala yung yang, nawawala yung kaya nag-chill ka. Do you remember that? Maingay. Am I talking sense? Yeah? Wait lang. Ano ko lang sila, maingay. Wait lang po. It's too noisy. You know, dito po sa lab, you have to understand. Sino ba yung maingay? Wait lang ha. Sir AK, please mute your mic. Naka-mute na pala. Okay. Chills kasi because nagkakaroon ng cold. Dahil ang wind will prevent the upright chi from reaching the surface. Kaya hindi mag-activate chi. No? Yung fever is actually a manifestation of a struggle. A struggle between the anti-pathogenic factor and the pathogenic factor. Yon. Can you repeat that, Ma'am Ami? Ang tanong ko, bakit may chills and fever pag exterior syndrome? Hello?
Hello, Doc.
Yeah, can you tell us bakit may chills and fever at exterior syndrome? Bakit ba nagkaka-fever ang tao?
Doc, pass muna po ako, Doc.
Ano? Kasasabi ko lang kanina, pass na. Okay, ganito yan ha. Yung fever kasi, parang may gera. Diba? Kasi merong invader merong kalaban na pumasok. Siyempre, pag ano ka, yung katawan mo, yung immune system mo, yung defenses mo, will have to fight the invader. Pwede mong hinaangkot. Okay, so if there is a war going on, definitely there is going to be some fever. Ngayon, yung chills, di ba chills, pwede mo parang Okay, una-una, it's a compensatory mechanism to keep you. Nag-chill ka kasi para uminit ka rin. At the same time, kaya nag-chills dahil malamig. Bakit malamig? Yung wind, yun ang nag-prevent ng upright chi na umakyat sa surface. No? Kasi kailangan talaga umakyat. So do you understand? Ma'am Ami, did you understand?
Yes, Doc.
Okay, let's go to number 12.
An arterial deficiency syndrome can be differentiated by the presence of A, chills, B, fever, C, sweating, D, thin tongue coating, E, superficial pulse. Exterior deficiency syndrome. Through sweating, Doc. Exterior.
Why is there sweating?
Doc.
Bakit may sweating? When you sweat, what happens to the pores? Are they the skin pores? Are they open or are they closed?
Open pores po.
So why are the pores open?
Dahil po may heat. Lumalaban po yung chi.
Sino ang involved in closing and opening the pores?
Defensive chi.
The ano?
Defensive chi.
Yeah, the Wei Qi. Okay, the Wei Qi is responsible for opening and closing the pores. Now, the last question is, who controls the Wei Qi? Who governs the Wei Qi? Sino yung bossing ni Wei Qi? The Lang Qi. Lang Qi, remember? Kalimutan nyo kaagad. Kailangan natin mag-imagine na. Okay, that's how detailed everything should be. Because these things, you know, you need to know para maganda yung pakiramdam ng pasyente. So the Lang Qi governs Wei Qi so that it can regulate the opening and closing of the pores. So ngayon, anong ibig sabihin? Okay. Pag sweating, masyadong bukas. Ibig sabihin, mahina yung exterior. Meron kang exterior deficiency syndrome. Okay? Number 13.
A patient has the following sign and symptom. Cough of 1 week, high fever. Cough of 1 week in duration, severe chill with high fever, no sweating, red complexions and yellow urine. The tongue has 18 coating and pulse is superficial, rolling and rapid. This syndrome belongs to A, exterior heat syndrome, B, exterior cold syndrome, C, intermediate syndrome, D, exterior cold and interior heat syndrome, E, true cold with false heat syndrome. The answer, Doc, is letter D, exterior cold and interior heat syndrome.
So, alin dito will tell you that there is something wrong?
Dahil, Doc, may ano siya, may chill siya, so kaya po may cold. Tapos yung interior heat syndrome naman is nagmamanifest po siya dahil may high fever and no sweating, red complexion, and yellow urine.
So the answer is letter D. Okay, number 14. Number 14.
Patient has the following sign and symptom: mild chills, fever, headache, cough, sore throat, loose stool, and clear urine with an increased output. This syndrome belongs to A. Exterior heat and interior cold. B. True cold and false heat. C. Exterior cold. D. Exterior and interior deficiency. E. Exterior and interior cold. The answer is letter A. Exterior heat and interior cold. Dahil mayroon po siyang exterior uridok, dahil meron siyang mild chill. Tapos dahil yung interior niya, yung heat niya po, exterior heat, meron po siyang fever and headache, sore throat.
Okay. Increased clear urine, increased output. Number 15.
A patient has the following sign and symptoms: desire to cover the body in spite of feverish sensation, flash face, tears, drinking warm fluid, clear urinary output, and loose stools. The tongue is light purple with moist white coating, and the pulse is superficial and weak. This syndrome belongs to A. True heat with false cold. B. True cold with false heat. C. Exterior heat and interior cold. D. Exterior cold and interior heat. E. Hyperactivity of yang due to deficiency of yin. Letter B. Letter B. True cold with false heat. Feverish.
Bakit mo ito? Bakit ito yung sagot?
True heat.
What was your basis?
A true cold. True cold with false heat.
How would you confirm kung true cold?
Yung true cold, pagka yung cold pattern niya is mas strong siya. Mas strong po kasi yung nakikitang...
Ano yung basehan mo? Ano yung titingnan nyo? Kasi very conflicting yung symptoms.
Pagmukha po yung flash face niya.
Are you not going to look at the tongue?
Yes, the tongue also.
Okay. So from the looks, from how the tongue looks like, how do you know, what can you say about the tongue?
The tongue is slightly purple with moist and white coating.
So walang heat, diba? Do you have any heat signs there? Sa tongue and pulse.
Superficial po siya. Nasa,
I'm sorry?
Superficial po ang pulse.
Is that telling us there is false heat?
False heat, Doc. Kasi po kung may heat po, dapat po ano siya.
Pero weak siya.
Siya. Kaya nasa
So kung true cold siya, dapat?
Ang true cold po
Dapat
is
deep.
True cold, nasa hindi pa po siya deep. Kasi pagka po heat na, deep na po siya. Mas deep po.
Okay. Thank you very much, Ma'am Ami. Great job. Let's go to, thank you po, Ma'am Annalyn De Asi, 16 to 20. Ma'am Annalyn, good evening. Ma'am Annalyn, are you there?
Yes po.
Yes. 16 to 20.
Number 16. A cold syndrome frequently causes all of the following except letter A, pallor, letter B, absence of thirst, letter C, preference of cold drink, letter D, white and moist coating, letter C, increased urinary output, which is fear. So cold symptoms frequently causes except preference of cold drink, letter C, preference of cold drink.
So ano dapat dito? Preference for what drinks?
Ano siya? Hindi siya cold, mga warm.
Okay.
And
Very,
hot kasi opposed.
yes.
I-oppose
They
niya
look
yung
for.
cold
So
syndrome.
if you have a patient who comes in, naghahanap ng, this is one way of really knowing kung ano yung pattern, no? Kung, cold, ano yung syndrome, no? Hindi nauuhaw, tapos the tongue is moist, no? Yun.
Opo.
Okay, this is very easy. Let's go to number 17. Heat syndrome.
17. A heat syndrome frequently causes all of the following except letter A, dark yellow and scanty urine. So, heat syndrome siya. Letter B, constipation. Letter C, fever. Letter D, dry tongue coating. And letter E, absence of thirst. So, lahat po dito, both A, B, C, and yung dry tongue coating are heat. The answer is letter E, absence.
Dapat may thirst, no?
Yes, kasi may heat syndrome. So,
Oo.
mauuhaw.
Yeah, maraming salamat. Correct answer is E. Number 18.
A patient has the following sign and symptoms: heat sensation in the chest, frequent desire to vomit, then abdominal pain alleviated by warm, loose stool. These syndromes belong to letter A, cold above with heat below, letter B, heat above with cold below, letter C, true heat with false cold, letter D, true cold with false heat, and letter E, exterior heat. So, the answer is heat above with cold below. So, yung coldness niya, meron sa baba kasi meron siyang loose stool and abdominal pain. So,
Okay.
if this indicates cold below, then heat above kasi yung sensation niya in the chest is mainit.
Okay. Confusing, no?
Opo.
Okay. Heat above with cold below. Thank you po.
Opo.
Number 19.
19. A patient has the following signs and symptoms: cold extremities, thirst, preference for cold drink, constipation, and scanty dark yellow urine. The tongue has a dry coating and the pulse is deep and forceful. This syndrome belongs to letter A, exterior heat and interior cold, letter B, cold above with heat below, letter C, heat above and with cold below, letter D, true cold with false heat, and letter E, true heat with false cold. So the answer is true heat with false cold, letter E. So yung true heat niya dito nag-manifest because of the scanty dark yellow urine. Then yung pulse niya is deep and forceful. Pero meron siya mga false cold symptoms. So like yung cold extremities. So this is a false cold syndrome, yung cold extremities. So yung heat nandun kasi meron siyang thirst, nauuhaw siya, constipated. Then meron siyang scanty dark yellow urine. Then yung tongue coating niya dry coating, ito yung dry coating, pwedeng false cold ba to? Dry coating. Opo. yung pulse niya, deep and forceful. So, true hit siya.
Actually, dito, based on your answer, ano yung dapat nating basehan
Ano po?
sa pagiging true? The tongue or the
Yung,
pulse?
yung pulse po. Yung tongue niya, di man masyadong nag-manifest. Has a dry coating. So,
yung true heat is determined by
opo, hidden.
Okay. Kasi misleading, di ba? Like if you look at the tongue,
Opo,
parang hindi siya in sync with the pulse. Kasi
opo.
supposedly, the pulse should be,
Ano dapat siya?
hindi siya dapat deep.
Opo, ma-shallow, mababaw.
Okay. Next. These are very rare cases, but of course you encounter them as well. Number 20.
Number 20, a patient has the following signs and symptoms. Afternoon fever, malar flush, heat sensation of the palms and soles, night sweating, dryness of the throat and mouth, and dry stools. The tongue is red with little coating and the pulse is rapid. These syndromes indicate belongs to letter A, deficiency of yin, letter B, deficiency of yang, letter C, deficiency of qi, letter D, deficiency of blood, and letter E, deficiency of qi and blood. So the answer is deficiency of yin.
Pag yang deficiency, ano po ang sintomas? Like, what do you expect to see in the tongue and pulse?
Deficiency ng yang po, magiging pale ang tongue. So hindi siya dapat red.
Ang pulse?
Ang pulse niya, slow. Pag
Okay.
deficiency of yang.
What about deficiency of qi? What do you expect to see in the tongue?
Deficiency of qi, pale din po.
Pale lang.
Opo. Then, pwedeng manipis, ang dila.
Pag manipis, it's more of,
Ano siya, fluid
blood.
and blood deficiency.
Yeah. What about the pulse in deficiency of qi? What is your basis?
Very slow. And yung ano po.
This is about
parang,
the force. Ano yan? Forceless.
Yan, opo. Walang force.
Force. Maraming salamat,
Opo.
Ma'am Annalyn. Thank you. Good job.
Thank you po.
Let's go ask Ma'am Darlene Federico. Are you still with Okada, Ma'am Darlene?
Good evening po everyone. Good evening, Doc. Yes po, sa Okada pa rin po, Doc.
Oo. Ewan ko lang, matutuloy ba kami bukas? Daanan namin kayo. Gusto na namin
Naka-day off po ako. Balak po pong pumunta sa LAMP tomorrow po.
Oh, so hope to see you in a while from 9 to 12. Maraming salamat po, Ma'am Darlene.
Yes po, Doc.
Are you enjoying our classes so far?
Yes po, Doc. From zero knowledge, ngayon unti-unting getting deeper na yung knowledge po. Thank you po, Doc, sa pagtuturo.
Tinan mo si Ma'am Ami, di na natatakot. Okay. Nakangiti na. Let's go to, 21 to 25.
Okay, Doc. Number 21, a patient has the following signs and symptoms: chills, cold limbs, listlessness, lassitude, spontaneous sweating, increased urinary output, which is clear and loose stools. The tongue is pale and the pulse is weak. This syndrome belongs to letter A, deficiency of qi, D, deficiency of blood, C, deficiency of yang, D, deficiency of yin. E, deficiency of qi and blood. Letter C po, deficiency of yang.
Okay. Ano yung pinakamalapit na pattern sa deficiency of yang? Yung ang difference lang cold. Diba? Pag deficiency of yang, cold na yan. So between deficiency of qi and blood, which is more malapit sa yang deficiency?
Qi po, Doc.
Yeah,
Deficiency
very good. Qi deficiency. So, qi deficiency, lagyan mo ng cold yan, yang deficiency na. Diba? Yes.
Yes po, Doc.
Now, let's talk about blood deficiency. Blood deficiency is...
blood deficiency is yin po.
Okay. And what do you expect to see in the tongue?
When it's yin, it's pale, pale tongue.
Yes. So, how do you differentiate a blood deficiency tongue from yin deficiency tongue?
Wait lang, Doc.
Alam mo yan, huwag ka matakot. By the way, ano ba yung basehan natin when it comes to pag sinabi nating yin deficiency? Ano yung una-una mong hanapin sa tongue? Will it be the color or will it be something else? Sige, mag-multiple choice din tayo. Are you going to look at the color, the shape, the coating, ang tatlo na lang, nakalimutan ko na yun. O the vitality?
Yung sa deficiency of
Yin.
yang, yin deficiency of yin,
will you expect, like, gusto mong, kasi pinapa-differentiate kita ng blood deficiency from yin deficiency. Now, gusto mong malaman, ano yung basehan mo? Like, the differentiating factor. Okay, una-una, di ba, both are pale. Deficiency siya. Okay,
yes,
we all know that pag sinabi mo blood deficiency, yin deficiency din yon. Ibig sabihin, mauna mo na yung blood deficiency bago mag-yin deficiency. Do you agree?
Yes, Doc. Yes,
Okay.
Doc.
Ang tanong ko
So,
is, what are you going to look for in the tongue to clinch your diagnosis of yin deficiency?
if the blood deficiency, it is pale. When it's yin deficiency, it is red tongue. And
Okay, wait lang. When you have yin deficiency, you will have a red tongue. Yeah, most cases kasi ng yin deficiency nakikita natin pag late. Pag meron na po siyang anti-heat. But it starts off as pale. So pag meron na po siyang anti-heat, that's the time the color of the tongue is red. My question is, what will be your basis? Ano yung hahanapin mo to clinch the diagnosis of yin deficiency? Are you going to look at the color of the tongue? Are you going to look at the shape? Or are you going to look at the coating?
The shape of the tongue, Doc.
What is the shape?
Thin po. It's thin shape.
So, ano ba ang shape ng, that's, ano ba ang shape ng tongue sa yin deficiency? Anong pagkakaiba? Di ba thin din pag blood deficiency, thin din pag yin deficiency?
Yes po. Pareho lang po, Doc.
Yung shape does not actually differentiate. So we're left with color and
coating.
Coating. Alam mo yan, na-stress ka lang. Wala naman tayong time. Okay, So you're
Pag
adding
yung
coating.
yin deficiency,
But
Doc,
you were right.
pale
I think you
and no
answered
coating.
coating.
Yes po.
Okay.
No coating po.
So pag walang coating, yin deficiency yan.
Yes po.
So bago nang wala ang coating, ano dapat ang nangyari?
Thick coating po.
No. Meron siyang normal coating like sabihin na natin, nagsimula siya as ano ba no normal coating ng tongue?
Almost no coating
Thin
po.
and
Thin
white.
coat.
Yeah.
Thin and white po.
No? Yeah,
Opo.
not almost, no, oh, yeah, thin and white. So, when you notice, are you familiar with the geographic tongue?
Yes po, Doc.
Tatanggal-tanggal. What do you call that condition? So that is what we describe as the coating is not rooted. Ibig sabihin, nawaksi-waksi na yung carpet mo.
Yes po, para siyang mapa po.
That is the start of stomach chi deficiency. Okay? That's stomach chi deficiency. So, eventually, pag hindi mo ginawa ng paraan, naubos lahat yung coating. So, what do you call that? That's what now we call
yin deficiency.
Yin deficiency. So, when the tongue, still devoid of coating, turns red, so what do you call that? Yin deficiency with empty heat. Right? Yes. So what's the difference between empty heat and full heat? Again, which one will have coating? Empty heat or full heat?
Sandali po, mahilig po ako. Empty heat,
walang coating.
Walang coating po.
So yung full heat, wala ring coating. Full, is it opposite to empty? Ano ba opposite ng empty? Di ba full?
Full.
So,
full.
pag sabi mong empty heat, walang coating, ano pag full heat? May coating.
Empty, may coating po.
Makapal ang coating.
Opo.
Right? Full, puno. Ang tanong, anong kulay ng coating? Yellow, right?
Yellow coating po.
Kasi maraming heat na. Samantala, yung empty heat, walang coating. Now, hindi mo pa rin siya, okay, umabot na ng 15 years yung yin deficiency with empty heat. So the tongue is red, no coating. What happens next? You will now have, what will happen when there's too much heat already? Just like what is happening to some of the forests. No.
Fire.
Yeah, there will be fire.
Fire.
There will be fire. That's how you develop stomach fire. Okay, when you have stomach fire, what do you expect to see in the patient? Di ba nagkakaroon ka ng ng mga sugat-sugat na sa bunganga, right? You can even have stomach kasi is gums. You can have bleeding gums, and even your dentist will not be able to do anything about it because bibigyan ka lang siguro ng hemostan, no, for the bleeding. So now you know, and I'm sure sa mga clients sa Okada, they will be very happy to know that they are in good hands because you know how to diagnose. And this time, you will be more careful in assessing them with regards to coating, to color, and to vitality or shape. Okay?
Opo, Doc.
Did that give you a lot of stress, Miss Darlene?
Ala-
Poise, maintain your poise. Let's go to number 22.
An excess syndrome frequently causes all the following except A, resonant voice, B, distension and fullness in the chest and abdomen, C, pain aggravated by pressure, D, thick tongue coating, E, night sweating. Letter A, Doc, resonant voice.
Is that your answer?
Yes, no po, Doc.
Except.
Night sweating po, sorry po.
Oh. Masyado ka affected kanina, di ba? I tell you, if you're going to remember that, ay nako, your patients will be happy. Okay, night sweating. How do you, like, what type of syndrome are you going to find it? Excess syndrome or deficiency syndrome?
Excess syndrome, Doc.
Bakit? Tinan mo, except na nga eh. Oh, excess
sorry po.
syndrome causes of the following. And in-except mo dyan, night sweating. So ang tanong...
sorry po, Doc. po.
Okay. So, night sweating, where do you find it? The answer is deficiency syndrome. But my follow-up question will be, what type of deficiency syndrome? When you have night sweating, what do you expect to see in the tongue? Are you familiar with yin deficiency?
Yes, Doc.
Do you have night sweating in yin deficiency? Yes.
Yes po, Doc.
Aside from night sweating, what else do you have? So a person with night sweating, what are you going to look for in the tongue? Stop looking at your notes. Just look at us. Kasasabi ko lang kanina, di ba? Na-stress ka tuloy. Okay. Anong itsura ng tongue pag yin deficiency? What is the color of the coating?
Thin coating, Doc. No coating.
Why did you answer thin coating? Is it synonymous to no coating?
Almost.
No, almost. No coating.
No coating.
No coating. Yeah. Diba? No coating. So initially, what will be the color of a yin deficient tongue?
Normal
Pale.
po. Pale.
Normal. Sorry. Pale deficiency na nga. So pale. So when does a yin deficiency tongue become red?
When there's a heat.
What type of heat? Full heat or empty heat? Ano na nangyayari sa'yo? Okay, when you have yin deficient... Huh?
Full heat po. Empty heat, sorry. Empty heat muna bago mag-full heat.
Iniisip mo siguro yung jowa mo, no? Joke lang. Sige, go. So, empty heat, right? Okay. 23.
A patient has the following signs and symptoms: aversion to speaking, lassitude, dizziness, spontaneous sweating. All symptoms become worse on exertion. The tongue is pale and the pulse is weak. This syndrome belongs to A, deficiency of Qi, B, deficiency of blood, C, deficiency of Yang, D, deficiency of yin. E, deficiency of qi and blood.
Answer.
Letter A, doc.
Okay, the key word
Deficiency.
here is on exertion. Worse on exertion. All the symptoms get worse on exertion. Okay? Next. So that's qi deficiency. When you say qi deficiency, there is no more optimal function of the organ involved. So what about blood deficiency? By the way, what do you mean by spontaneous sweating?
Spontaneous sweating is cannot control anymore. Continuous na siya, doc. Hindi na maano, hindi
When you
na...
say spontaneous, ibig sabihin, kahit hindi mainit, pinapawisan ka. Okay? I'm sure you've seen patients when you hold it, when you shake hands, when you make,
Yes po.
you know, their palms are sweaty. So when you see those patients after they come to you, di ba? Yung PF nyo dyan sa Okada, malaki, di ba? Huwag mo na sabihin, baka ano. So yung mga Okada, di pa kami nakapunta na Okada, but we've heard a lot about Okada. I hope matuloy bukas. We'll see you. Anyway, yon. So, spontaneous sweating, kahit hindi mainit, pinapawisan ka. Basang-basa yung pawis yung likod mo. No? Lalo na pag mainit.
So, pati yung palm and yung sa paa, doc, ganun din po yun. Yun na po yung spontaneous sweat.
Yes. Yeah, that's very qi deficiency. And then you have to really explore kung ano po yung organ involved. That's where your diagnostics come in. Okay?
Okay.
And siguro within the next few sessions, we're going to already inject more medical conditions, no? Para medyo mas ano kayo kasi sa hospital. Like hyperhidrosis, ano ba yun? Ano yung kanyang counterpart sa ano? Kasi these are the cases that you will meet. Ganun na po ngayon ang curriculum ng PTAC, no? Binigay. Which is naman for medyo stressful sa iba, but you know, magagaling kayo di ba? Love kayo. Stress lang yung iba. So thank you. Pati naman di ko napansin. Hindi mo binabasa yung mga group chat sa chat box. O marami ka palang lifeline. Oo, may iniisip ka lang kasi, ramdam ko talaga, no? O, number 24.
Number 24, a patient has the following signs and symptoms: dizziness, lassitude, a bearing down and distinct sensation in the abdominal region, and prolapse of the anus. The tongue is pale and the pulse is weak. This syndrome belongs to A, deficiency of qi, B, deficiency of yang, C, stagnation of qi, D, perversion of qi, E, sinking of qi. Letter E, doc, sinking of qi.
Very easy. Sinking of qi. Lumalabas na yung nag-prolapse na yung anus. Sometimes pag babae, may lumalabas na yung matris, no? So that's what we call rectal prolapse. So you can do a lot about it, okay? By the way, Ma'am Darlene, you should try to read up on, kasi we'll be doing only bukas na. Although I know you love to do massage. Sana maraming pupunta. We will have a tent outside of LAMP. Kasi barangay ito Sampaloc, Extremadura. So we're going to always perform the ear. I hope you're very familiar. You observe how we do it. It's fast. So you can even just use ear seeds. In fact, some people were amazed. It's faster than the needle, than the body acupuncture. Okay, so una you need to do Shenmen, pag babae sa right, lalaki sa left. And compare, sige, anyway, we'll have a briefing if there's time. It's so amazing, actually. So, less is more. Just use 4 or 5 needles. Pwede 3 or 4 nga lang. Or seeds. Kasi pag seeds, you just have to rub the, like, dito. You don't put needles here. You put the needle, the ear seed here and another sa likod. The whole area that's so tender. Like, especially dito, yung medyo sa my neck area. Ganun-ganun mo lang siya ng 1 minute. The person will be amazed. Wow, how come nawala? No? And remember, this is medical mission. And then you have to, of course, dito kasi sa atin, we treat the cause, no? Only the mediocre practitioners don't treat the cause because they wouldn't know how to determine the cause. But you're with lump and with all the pressure, and we make sure that you're very good at diagnostics. Alam nyo ganito, if you know an acupuncturist and who doesn't do pulse and tongue, hindi siya from lab. That means hindi siya ganun kagaling. So you have no right to practice, right? You just don't make tusok and tusok there. So I'm very proud that those that we have trained, who have joined medical missions, they impress a lot of people, especially the MDs and the nurses, because I think we're the only ones who do that. Yung iba daw hindi, tusok lang na tusok. Saka mas effective kasi ear lang eh. So when you just depend on donations for needles or mas nakakatipid kami. So there was one big group, they call themselves APO, the Apple, and sabi nila, we just close the deal. Sabi nila, they won't look at any other acu groups anymore but lab. In fact, they would want to use the for their trainings and all. So God is good. We feel so blessed. And I hope you all live up to the expectations. Kasi magkakaroon tayo ng global branding. Call me mayabang, but libre naman mangarap, di ba? And when you have a dream, you have to work hard for it. And we cannot do this alone. We have to spread it and all over the Philippines so that by 2027, we can have our international convention, which was actually done by the Queen of Acupuncture in 77. So 2027, that would be 50 years after, kasi nobody has ever done it. So we hope dadami tayo and fruitful naman yung pagbisita ko rito, and yun. We started it with Baguio, and so amazing, they're so fast. They're so magaling. Andito si Ma'am Joy. So na hindi ko makalimutan yung niya na the cookies and the ewan po yung mga pagkain doon. And I think it's because they love what they're doing and it's something new. Sa panahon kasi ngayon sa wellness, you have to give something different if you want to
stand up.
If you want to be number one. Ang gusto ko mangyari, call me, there should be no number two. Okay? Because I was a full scholar with my medicine, so gamitin na natin dito. In fact, I would have wanted to pursue a career in music, but since I did well in my preparatory course, I was offered a full scholarship. So ngayon, sabi ko, parang di ako masaya. Kasi di ba, alam mo, So, pero ngayon, dito ko na pinakita because I'm more into natural, I'm more into something different. You have to be unique, you have to be good, you have to excel. So, I was so humbled when Dr. Palanca saw that, made me the So, I was the vice chair. So now that she's gone, sana magtulungan tayo and hope we could get more people to join us. We're hoping that we can have 1,000 people in our roster by end of 2023, so that by next year, when we celebrate her birthday, and we will probably have graduates already for the CAA by then. If you notice, I'm getting people who know, who are really good. And so like Dr. Webb Lim, she is the president of the Philippine Acupuncture Association. So nobody could question his integrity. So yun, kaya yung mga CAA na gustong humabol, meron tayong good news. Ewan ko kung na-post na ba ni Sir Albert, mukhang hindi na yata natutulog. For those who want to make habol, we have special programs based on the PITAC guidelines. So ito kasing atin natin, we've started this like 14 weeks ago already. Okay, nandito na nagpa-flooding na naman si... Okay, sige, yun. Anyway, meron pa siyang iaano, just keep posted for no? It will be given by Dr. Webb every Thursdays, and we'll see what we can do based on the number of hours para marami tayo. So we hope that you can invite more people. Hindi pa tayo tapos, nagmamarites na tayo. So yun lang. I just want to inform everyone that I'm a stickler for quality. No, it speaks a lot about. I tell you, if wala kasing shortcut and hindi ako niniwala may bobo, tamad lang, no, and not willing to accept criticism. So let's all aim for number 1 so that there will be no number 2. Okay? So
Yes.
ano lang tayo, tuloy-tuloy. So Ma'am Darlene, I hope you can ace this question. I think this is very easy. So yeah, sinking of chi. Maraming salamat po. Let's go to number 25.
Number 25, stagnation of chi can be differentiated by the presence of the following symptoms. A, lassitude. B, hiccups. C, distenting pain. D, hollow pain. E, bearing down and distenting sensation in the abdominal region.
Okay. Answer.
Letter C, Doc, distenting pain.
Remember this, distending pain. That's very chi stagnation. What about bearing down sensation? Anong pattern? That's sinking chi, right? Kanina lang, di ba?
Yes po.
What about hollow?
Nagiging weak na po, Doc.
Pag hollow pain.
Hollow pain, deep na po to pag hollow, Doc.
Hollow is deficiency. That's chi deficiency or blood deficiency. Hiccups, that's rebellious, no? Okay, well. Maraming salamat, Ma'am Darlene. Alam ko na stress ka.
Thank you po, Doc. Thank you po.
Bukas early ka. Hope to see you tomorrow. Thank you.
Yes po.
Good job. Okay, let's go to the next. Let's call on Ma'am. Sana hindi pa kayo inaantok. Oh, Ma'am Lane Arandia. 26 to 30.
Good evening po.
Good evening, Ma'am Lane.
Number 26, a patient has the following signs and symptoms: pale complexion, pale lips, dizziness, blurred vision, palpitation, insomnia, and numbness of the hands and feet. The tongue is pale and the pulse is steady. This syndrome belongs to A, deficiency of qi, B, deficiency of blood, C, deficiency of yang, D, deficiency of yin, and E, sinking of qi. Ito pong deficiency of blood, mayroon po kasi siyang pale complexion. Tapos pag may pale lips din po siya. Kaya ang sagot po letter B, deficiency of blood.
Anong kaibahan ng deficiency of blood sa deficiency of yin?
Ang deficiency of blood po yung tongue niya po is pale din, dry, tsaka thin. Ang yin deficiency, no coating.
Ang galing. Okay, thank you very much. Let's go to number 27.
Number 27, stagnation of blood frequently causes all of the following except A, pain, B, tumor, C, hemorrhage, D, pale lips, E, ecchymosis.
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 Google that. No? We will all become medical acupuncturists, so you have to exert effort. Ecchymosis. Okay?
Ecchymosis.
Pag mali ang pronunciation yan, hindi ka from lab. Okay? Okay.
Ito pong,
ano yung ecchymosis na yan?
ecchymosis, a small bruise caused by blood leaking from broken blood vessels into the tissues of the skin.
Yeah. So, ano answer dito? Ano yung exact?
Yung letter D po, pale lips.
Anong kulay ng lips pag mayroong blood stagnation?
Purple.
What is the earliest sign of blood stagnation in the tongue?
Early stage.
You look under the tongue.
Yung
Pag
vein.
nakita mo yung sublingual veins. Yeah. So, ibig sabihin, kahit hindi pa purple yung tongue mo, kung gusto mong malaman na ano, usually wala pang symptoms yan eh. Binabaliwala mo lang. So, pag yung sublingual veins, nakita mo, bakit parang halatang halata. Hindi siya dapat halata. Hindi siya dapat distended. Okay? Hindi mo siya dapat napapansin. Although meron siya, pero hindi siya napapansin. Yung iba makikita mo, parang may earthworm sa ilalim. Na talagang purple na purple. And that's, don't panic. As long as the tongue is not purple, then there's not much to worry. So that means you have to continue giving acupuncture treatments until that sublingual vein distension disappears. Are we okay? So, in the future, when they know you're lump trained, they will have more confidence because you know what you're doing. No? Ang gusto ko, you have to learn how to talk to your patient. Hindi po pwede yung parang para tayo mga rogue. Parang, you know, isang tanong. Alam nyo, you have to like your patient. You have to love your job. And you should, you know, take selfie. You encourage the patient to take selfie. Or you take a picture of the tongue and under the tongue and yun, the face. In the future, we'll also talk about the face. But by that time, marami na po kayong alam, no? Remind me to give you the book on clinical. It's actually it's a medical book full of pictures. Hindi siya boring. It's clinical diagnosis. So, yeah, I'll give it probably later, no? Together with your week 5 next week. Excited na ba kayo? Ganun na po talagang labanan, no? Lalo na pag gusto mo maging number 1. Pag gusto mo mag number 1, dapat walang number 2. No? Yeah. Okay. Maraming salamat. Let's go to number 28.
Number 28, a young female patient has the following signs and symptoms. Lower abdominal pain, which usually starts before menstruation. The menstruation is delayed, scanty and dark purple with flats. The tongue is purplish with purple spots on the edge and the pulse is deep. This syndrome belongs to A, deficiency of blood, B, stagnation of Qi, C, stagnation of blood, D, deficiency of Qi, and E, deficiency of Yin. Ang ito pong letter C na stagnation of blood. Kasi po may keyword po dito na scanty and dark purple.
Okay. May mga clots, no?
Opo, with clots.
But nakita nyo, purplish tongue with purple spots on the edge. The edge represents the liver. So for women, when you talk about menstruation, always consider the liver. Deep pulse. Next.
Number 29, a patient has the following signs and symptoms: mental restlessness, bleeding, and a dry mouth with no desire to drink. The tongue is deep red and the pulse is rapid. This syndrome belongs to A, stagnation of blood, B, heat in the blood, C, deficiency of blood, D, deficiency of yin, E, cold in the blood. Heat in the blood po, Doc, dahil mayroon po siyang
Bleeding?
isa rin po yun, tsaka dry mouth na hindi siya na
Ano pa? Tongue is
tapos
deep red.
restlessness. Opo.
Deep red. Red na red.
Tapos yung pulse niya po is rapid.
Okay, let's go to number 30.
Number 30, a patient has the following signs and symptoms: dizziness, aversion to speaking, lassitude, and sharp pricking pain in the hypochondriac region. The tongue is pale with purple spots on the edge and the pulse is steady and string thought. This syndrome belongs to A, deficiency of qi and blood, B, cold in the blood, C, deficiency of qi and stagnation of blood, D, deficiency of yin and stagnation of blood, E, deficiency of yang and stagnation of blood. Letter C po, Doc, deficiency of qi and stagnation of blood. Kasi nga po ang tongue niya is pale tsaka purple spots on the edge.
Okay. When you have stagnation of blood, there is definitely pain. And pwedeng, tinan nyo, string thought or wiry po yan, wiry. Parang pulse parang violin, okay? Violin string, okay? So, yeah. Maraming salamat, Ma'am
Thank you po.
Lane. Yes, thank you. Good job. Let's go now to, can I call on Ma'am Lynn Galarita, 31 to 35. Ma'am Lynn?
Yes po.
Yes.
Can you hear me?
Of course.
Okay. Okay, number 31. All of the following signs and symptoms may be due to deficiency of blood except letter A, malar flash. May question kanina, Doc, na dinitali na itong mga symptoms of blood.
Yes. Paulit-ulit.
Okay.
So your answer is?
Letter A, malar flash. Yin deficiency po yun eh.
Okay, good. Inunahan mo na ako. Okay, number 32.
Number 32. A patient has the following signs and symptoms: palpitation, shortness of breath, becoming worse upon exertion, and fullness of the chest. The tongue is pale with a thin white coating and the pulse is steady and weak. These symptoms belong to letter A, deficiency of heart qi.
Okay.
Yung palpitation, heart na po yun eh, shortness of breath, becoming worse upon exertion, indicative of qi deficiency po.
Yes, very good.
So,
wow. Okay.
Heart qi.
Can you tell us ano yung pakiramdam ng patient pag may heart yang deficiency?
Heart yang deficiency, probably merong
Wag mo
chills,
probably.
cold limbs.
I don't like that answer, probably. So actually,
May cold limbs.
heart qi deficiency plus
Lassitude.
No.
May spontaneous
No,
sweating.
I said ganito. When you say heart yang deficiency, it's actually heart qi deficiency. Ibig sabihin, lahat ng symptoms ng heart qi deficiency on plus heart yang deficiency. Parang pinalala mo lang yung qi deficiency. I mentioned that, I think, in the first part.
Yeah. Heart chills.
Cold. plus cold. Cold limbs, cold everything, you feel cold,
Plus,
whatever. Okay? So pareho lang siya sa heart chi. Ibig sabihin, pag heart yang deficiency, merong heart chi deficiency plus cold. Feeling of cold, cold feet, cold limbs, gano'n. Okay?
Okay. Okay. Thank you, Doc.
Oh, hindi pa tayo tapos. Punta pa tayo sa heart blood deficiency.
Heart blood deficiency.
Okay. When you talk about heart blood deficiency, ano ba ang kailangan ng Shen para magkaroon ng tahanan? No, Shen is spirit, the mind. Kasi pag wala siyang tahanan, magiging restless siya. Kaya nagkakaroon ka ng craving, parati kang like since gising ka pa ng alauna, uso sa iyo ang midnight snacks. Kinakain mo yung cookies ni Ma'am Joy Enriquez, no, na napakasarap. Nagkakaroon ka ng craving. That's actually a manifestation of a restless Shen. So ang tanong ko, ano ang kailangan ng Shen para hindi siya maging restless? Kailangan mo ng
sufficient heart blood.
Very good. So, what happens when you have heart blood deficiency? Will you be able to have good sleep? Will you be able to sleep easily?
Magkakaroon ng insomnia.
Yeah, hindi ka makatulog kaagad. Kasi nga gutom ka. So, okay, sabi na natin 10:30, 11, usually ganon. Hindi ka makatulog. So, mag-ano ka pa, kung ano-ano pa yung pinagbabasa mo. Tapos yung mata mo pa. So, 1 a.m. na, so gising ka pa. Usually,
parang ganyan ako, Doc. Maya-maya gumigising.
So, ma'am,
Putol-putulan tulog.
kung ganyan ka, ano ang makikita mo sa tongue?
A red tip ang tongue ko, Doc. Deficient or indicative of heat.
Is that telling us that you have heart blood
pale.
deficiency? Okay,
No.
ano ba kulay ng
Pag heart blood, dapat pale ang tongue.
Okay, what else? Will it be wet or dry?
Dry.
Will it
Kulang
be
sa dugo dry.
Will it be thin or fat?
Thin po. Kulang nga sa
Are you
dugo
talking from Are you talking from what you see in your actual tongue?
Pero yung actual tongue ko po, baka hindi din heart blood deficiency. Kasi red tip yung tongue ko eh. May part na may coating. I have hypertension.
Yeah. There is
Tapos may complex siguro yung aking hindi ko pa
sige,
ma-diagnose
matututunan mo
ng
pa rin
tama.
yan. We will go there. We'll get there. What about lung qi deficiency? Of course, you don't see anything in the tongue. Qi deficiency pa lang yan eh. Wala eh. No? Pale lang siya. Pale lang yung tongue. But when you say lung qi deficiency, mahina na po yung ating, like everything will be with an effort, right? So,
Mahinang boses.
magkakaroon ng shortness. Yeah, mahinang boses, shortness of breath. That's lung qi deficiency. Pag hinawakan mo yung kamay niya, medyo malamig. Yun, namamawis pa. Because yung lung qi mahina, hindi niya pwedeng isara kasi the lung qi controls your skin pores. So the skin pores remain open. That's why when you make lamano and it's so basa, then so make sure kung nagpagamot sa iyo, nagpa-acu, siguro after 3 sessions, hindi na siya basa. Okay?
Okay.
And last one, letter E, invasion of the lung by pathogenic wind. Just like what happened to me. I don't want to look at my tongue. But anyway, so sabihin na natin cold.
Pathogenic wind, cold. Merong fever.
Would you expect to see anything pag wind cold invasion? Wala, di ba? It's going to be normal, thin white coating. Yeah. And pag wind heat, pag mainit ang araw, meron ka makikitang spots sa tip and the sides. Okay? Yung red tip mo, madam, that's hit in the heart.
Yeah.
And you're very sensitive. Number
Hindi
30,
siya nawawala.
walain natin.
Despite na medication, kaya ako nag-aaral ng acupuncture po.
Can you tell us, sige later na lang. Makikita naman tayo siguro. Number 33.
Number 33. A deficiency of heart yang and a deficiency of heart qi can be differentiated by the presence of the following symptoms. A. Palpitation. B. Shortness of breath. C. Spontaneous sweating. D. Chills. E. Intermittent pulse. Parang ito na yung tinanong nyo kanina, Doc. So, chills. Parang code.
Oh, chills.
Code na
yeah.
din.
34.
Number 34. Patient has the following signs and symptoms: chills, cold limbs, palpitation, cardiac pain, and pale complexion. The tongue is pale, swollen with white moist coating, and the pulse is steady and weak. This syndrome belongs to letter C, deficiency of heart yang.
Yes. Now, I think you will know what I will ask next. Ano ang heart-blood stagnation? Isip. Anong kulay ng tongue pag mayroon ka ng blood stagnation?
Purple.
Yes.
Purplish tongue.
And what do you think ang mararamdaman ng pasyente? Will there be chest pain?
Yes, stabbing pain po pag stagnation.
Yes. Okay, great. What about deficiency? Ay, paulit-ulit na lang the same. Kidney yang deficiency. Will the patient have impotence? Will the patient be a bit frigid? Will there be
Kulang
infertility?
sa init, Doc. Mababa ang libido.
Yeah, great. Very good. Plus low back pain and masakit yung knee. Okay. Done. Number 35.
Number 35. A patient has the following signs and symptoms: palpitation, insomnia, dream disturbed sleep, poor memory, sensation of heat in the palms of the hands and soles of the feet, and night sweat. The tongue is red and the pulse is steady and rapid. This syndrome belongs to deficiency of heart yin, letter
Okay,
B.
very
Kasi
easy.
yung mga symptoms niya, yin eh.
Oo,
So,
pabalik-balik lang, di ba? Biging-bingi lang nga kayo.
naging heart kasi may nandun yung palpitation.
Pero no, actually, ano to eh?
Yeah.
Deficiency of heart yin with empty heat. No? So pag understood na yan. Tongue is red, pulse is steady and rapid. Okay. Pag liver yin deficiency, what are you going to feel?
Liver yin deficiency.
Ganun din. Except that meron kang headache, meron ka ring irritability, that's very liver. And you can also have numbness. Kasi this is a progression of liver blood deficiency. Di ba? Liver blood deficiency muna bago magkaroon ng liver yin deficiency. Maraming salamat, Ma'am Lynn.
Okay po.
Good job. Let's go now to... Okay, can I call on... Okay. Si Ma'am Salvacion ba is a CAA aspirant? Hello, Ma'am Salvacion. Yeah, like let's see. Are you there? Bakit walang... Okay, let's call on Ma'am Lori Saguban. Ma'am Loris. Hindi siguro ito sila Anyway, they just came to observe probably. Okay, let's call again. Let's call Dr. Sam, please. Dr. Sam. Naku, baka natulog na sila. Dr. Sam, are you there? Okay, let's go back to Ma'am Annalyn, the ASIS. Ma'am Annalyn, 36 to 40.
A patient has following signs and symptoms: mental depression, dullness, incoherent speech, and weeping or laughing without an apparent reason. The tongue has a white, sticky coating, and the pulse is string, tough, and rolling. This syndrome belongs to letter A, hyperacidity of heart fire, letter B, stagnation of heart blood, letter C, deficiency of heart blood, letter D, phlegm, missing the heart, then letter E, deficiency of heart yin. Answer po is letter D, phlegm, missing the heart.
Yeah, so sino dito may phlegm missing the heart? Hindi, joke. So, tingnan nyo ha, kung meron kayong ganyang pasyente, depressed, hindi na maano yung speech, no? Umiiyak na lang bigla. Yeah. So, I hope nobody... So, tingnan yung mga dila, no? So, look at the dila. The dila will have a white, sticky coating.
White,
very phlegm. And it misses the heart. So, yon. Usually, bilugan yung tongue, no? Rolling is also slippery. Let's go to number 37.
Number 37, a patient has the following signs and symptoms: feeble cough, shortness of breath becoming worse upon exertion, clear dilute sputum, and spontaneous sweating. The tongue is pale with a thin white coating and the pulse is weak. This syndrome belongs to letter A, invasion of the lung by pathogenic wind, letter B, deficiency of lung qi, letter C, deficiency of the defensive qi, letter D, retention of phlegm in the lung, letter E, deficiency of the primary qi. Answer is letter B, deficiency of lung qi.
Yes, okay.
Opo.
Answer is deficiency of lung qi.
Of lung qi.
Kita nyo, ang keyword dyan, upon exertion. Qi deficiency talaga. No? So, you need to start getting cases, 30 different cases, 30 different patterns. And ito po yung nilalagay natin sa ating matrix. So, every time you're in Manila, we hope to have more like pag sinabi, kaya nga ngayon pa lang, sinasanay ko mga katao pupunta rito para marami kayong pasyente. And you need to have somebody, a CMA, like Dr. Webb, to actually, so if I were you, you start preparing your 30 patients, 30 different patterns. Okay? So this is one of them. Maghanap na kayo ng si Raulo. That's phlegm misting the heart. And kailangan mo lagay, ang kulang na lang is yung mga points. No? So we'll probably take that up sa module 3 when we start discussing the points as well in detail, as well as the, Number 38, Ma'am Annalyn.
Number 38, a patient has the following signs and symptoms: cough with white sputum, fullness and stuckness of the chest, and asthmatic breathing. The tongue has a white coating and the pulse. This syndrome belongs to letter A, invasion of the lung by pathogenic. Letter B, invasion of the lung by pathogenic. Letter C, retention of phlegm down in the lung. Letter D, retention of phlegm in the lung. Letter E, deficiency of the lung. The answer is retention of dump phlegm in the lung.
Okay, very good. Easy.
Very
Phlegm, yeah, phlegm dump, white sticky sputum, white sticky coating, rolling. Rolling is also slippery. Stuffiness of the chest. Okay. So, kung napansin nyo, napaka-importante ang tongue analysis and the pulse. Okay. Next, 39. We're almost done.
A patient has the following signs: cough, chest with a smack and yellow or one. The tongue is red with a yellow coat and the pulse up. This syndrome belongs to letter A, invasion of the lung by COVID. Letter B, stagnation of heart blood. Letter C, retention of phlegm dump in the heart. Letter E, phlegm fire disturbing the heart. Letter E, retention of phlegm in the lung. The answer is letter E, retention of phlegm in the lung.
Okay. Ano po yung basis ng sagot nyo?
It's yellow tube.
Okay, very good. And there is also
Coating ng tongue, which is
okay.
red with a sticky yellow coat.
Yeah. Marami pong ganito. So, dapat nyo makita yung phlegm. So, tingnan mo na lang yung tongue. Number 40.
Number 40, a patient has the following signs and symptoms: abdominal pain, diarrhea with blood for 1 day, crazy yellow urine, and a burning sensation in the eye. The tongue has a sticky yellow coat and the pulse slowly traveling. This syndrome belongs to letter A, invasion of the lung by pathogenic bacteria. Letter B, consumption of fluid in the lung. Letter C, deficiency of lungs. Letter D, dump in the large intestine. Letter E, stagnation of cheese and the large. Answer is letter D, dump in the large.
What is the basis of your answer?
Deep yellow urine and a burning sensation in the eye.
Okay, very good.
Large.
Maraming salamat, Ma'am Lynn. Ma'am Annalyn, sorry. Thank you very much. Now let's call on Ma'am Ami again, Ma'am Ami Glorioso. 41 to 45. Ito kailangan nyo to i-screenshot. Remember this. Napakaraming ganitong cases. Ma'am Ami, please.
Which of the following prescription is the best for treating abdominal pain caused by retention of blood?
Food.
Food, sorry.
Ma'am, ganito. Ma'am Ami, before you answer that, ano po ang itsura ng tongue pag retention of food?
Retention of food is...
Based sa coating. Saka ano yung... Kasi magda-diagnose ka may abdominal pain. Ano ba yung cause? No?
Yellow po. Retention of food. Yellow coating.
Okay. Double check that. Okay, sige, let's see. What is your answer here? Just give us your answer.
Letter E. Red 12, stomach 25, stomach 36, and extra point for inning, meeting.
So that's your answer.
Letter E.
Okay. Stomach 12, stomach 36 and REN 12. REN 12 is the front view of the what? Of the stomach. Diba? Okay. So that's your answer. Does everybody agree? Bakit natin hindi ginamit si letter A? Or bakit hindi natin ginamit si letter? Okay, basta yun. Okay, so that's your answer. Sagutin na natin yan next time. So that's your answer. Why did you choose that answer, Ma'am Ami?
Regarding po to sa stomach abdominal, because of abdominal pain. So meron tayong mga points for
Bakit hindi tayo gumamit ng bladder 20?
ang bladder 20.
Kasi pag bladder 20, medyo ano na, di ba? Chronic. Ito siya, siguro, sa dami ng pagkain, uminom ng soft drink sa malamig, nagkaroon ng retention of food sumakit. Do you agree?
Agree, Doc.
Yeah.
Agree, Doc.
And so, you use these points.
Yes, Doc.
How do you classify stomach 36? Ano po classification ni stomach 36?
Stomach 36, Doc, is good for ano po yan yung para pong nagpapalakas po ng stomach.
No. When I say classification, ano ba siya? Ano bang category siya? Okay, ganito. Ang category, ang classification ng stomach 36 is Hussey point of the stomach meridian. Hussey or Hussey. Yung C point, remember? It's also called the command point of the abdomen. Ibig sabihin, remember you have abdominal pain. Nagamit ito to actually relieve any abdominal issues. It is called also the point of the sea of water and grain. That is how you should answer the question. So, let's go to stomach 25. Para saan si stomach 25? Stomach 25, ano ang classification? Stomach 25 is actually the front move of the large intestine. Kailan natin ginagamit yung front move? Pag acute. Nag-retain lang yung food No? Para bang na-impacho ba tawag yan? No? So, what about REN 12? Is it also a front view point? Anyone?
Front view point of the stomach.
Yes, front view then. So, why did we not? Okay, front view point of the stomach. It's also called the converging point of the food. Katulad ng large intestine, fu yan. No? Yon. And then we have the extra point, innervating. So this is actually very good for the stomach as well. So yun ang mga reason. Command point ang stomach 36. And stomach 25 is the front view of the large intestine. REN 12 is the front view of the stomach. Okay? So what else? Any questions? Any comments? So ano yung what to do pag nakaroon na po tayo ng retention of food? Masakit po ang tiyan yan, saka merong parang merong palabas na. Okay? Okay, let's go to who would like to take over. Thank you, Ma'am Ami.
Okay, thank you, Doc.
Number 42, let's call on Ma'am Darlene again. Would you like to answer 42? Which of the following is the best for treating abdominal pain caused by the accumulation of cold naman? Siguro naman alam nyo na by this time anong itsura ng tongue. No? Ma'am Darlene, what's your answer?
The answer for number 42, Doc, is letter C.
Why?
Ren 12.
Okay, you answer letter C because this is quite recent, no? And ginagamit natin din yung spleen 4 because this is the luo connecting point of the spleen. Ibig sabihin, if you needle spleen 4, ang impact niya sa stomach. Ito tone down niya. So, ibig sabihin, paiinitin niya ngayon kasi cold eh. Do you follow? And so, what particular modality are we going to do on REN 8? Are you allowed to needle REN 8, Ma'am Darlene? Nasaan ang REN 8?
Sa umbilicus.
Can we needle it?
Yes po.
No.
Max Sebastian po.
Yeah, you don't needle it. You just do indirect Sebastian. Lagyan mo ng ginger, basta tabunan mo siya, basta yung ginger butas-butasan mo para mainitan. Bakit ka mag-mock Sebastian? Because there is accumulation of cold. Diba? So that's it. So you know what to do. Anong expect mo makikita sa tongue? Are you going to see a dry tongue or a moist tongue?
Moist tongue po, Doc.
Are we going to see a wet tongue or a pale tongue?
A pale tongue po with the moist tongue.
And elongated tongue or a swollen tongue?
Swollen tongue.
Okay. Swollen tongue.
Swollen tongue.
Okay. Thank you, Ma'am Darlene. Let's call on Ma'am Angel once again. Hello, Ma'am Janine. Wow. Welcome. Let's call on Angel. Ma'am Angel. Wow, the queen of Cozy Cove, who is now almost an acupuncturist. Good evening. It's okay. We're about to, yeah. Ma'am Angel, can you answer number 43? Ma'am Angel. Andyan ka pa ba, Ma'am Angel? Ay, nawala na siya. Anyway, let's call on Sir AK. Sir AK, can you answer number 43, please?
Okay, Doc. Number 43. The best prescription for patients who complain dizziness, irritability, flash, face, red eyes, tinnitus, bitter taste in the mouth, and dream disturbed sleep would be letter E, Doc. Gallbladder 20, liver 2, kidney 3, bladder 18. Ito Doc, clearing heat, yung liver 2, water point, kidney 3, earth point, gallbladder 20,
gallbladder 20 is for wind. Okay, very good. Why bladder 18?
GV 18 is
Bakshu of
Okay.
Liver.
Liver.
red eyes. Bitter taste in the mouth. Diba? That's very liver. Bitter taste in the mouth. Okay?
It.
Sige, ituloy mo na, Sir AK. Number 44. Para matapos tayo.
Okay, number 44. Which of the following prescription is the best for treating a patient who complains of dizziness with heavy feeling in the head and suffocating sensation in the chest, nausea, profuse sputum, anorexia, and somnolence?
Your answer.
Answer is letter A, stomach 40.
Bakit mo ginamit ang stomach 40?
Stomach 40 is for
Phlegm.
ano to, Doc? Phlegm.
Saan dito ang nakikita mo na indicate na may phlegm? Heavy feeling.
Doc, heavy feeling.
So why did you use bladder 20? Ano ba yung bladder 20? Bakshu of the
stomach, Doc.
Sure ka? Hindi Bladder 20. Bladder 20, di ba? Bakshu of the
Spleen, Doc, spleen.
spleen. Ba't sinabi stomach? Chronic to, di ba? Chronic. What is somnolence?
Laging inaantok, Doc. Parang groggy.
So, paano mo bubuhayin? Okay, bakit kaya nagkaroon ng somnolence? Hindi na umaakyat. Wala nang nourishment ng brain. Hindi na na-active. You got yung feeling. Yeah. Why did you use stomach 8?
Feeling, Doc, in the head and yung sa ulo, Doc.
Crossing point kasi siya, no? Ng stomach and gallbladder meridians. So, maraming salamat. Let's go to number 45. Ikaw pa rin.
Sige, Doc.
Number
45. Which of the following prescriptions the best for treating a patient suffering from a common cold of the wind heat type? So, the answer is, ito, Doc, letter D. Duke 14.
Bakit mo kagagamit ang Duke 14?
Ano to, Doc, nagtatanggal din to ng init, Doc,
Fever, no? Febrile disease. Windy kasi, di ba? Clears. Very good. What about, actually, itong 214, crossing point yan ng tatlong young meridians sa kamay and young meridians, tatlong young meridians sa foot. So why did you use, yeah, LI11, excellent point, right?
Oo. Si point, Doc.
LI4.
Natanggal siya ng...
Yeah. Why did you use LI4?
Ganon din, command point of the head and face.
Yeah.
One source
natanggal
point.
Din siya ng... Yung one source point na, Doc. Tama,
okay. Thank you. And also lung 10. Anong klaseng point in lung 10?
Lung 10 is the jinye.
Lung 10, nandiyan din si lung 11. Magkakaiba ng dalawa.
Jingle tsaka Ying River. Ying Spring. Nagtatanggal pareho ng init.
Okay. Sige, pagod ka na. Punta naman tayo sa iba. Maraming salamat, Sir AK. Punta naman tayo kay Gusto mo pang mag-continue? O nahiya ka lang mag-no?
May maingay daw sa tabi kong bata.
Sige, sorry. Okay lang. Sige. Let's call... Sige, magtulungan tayo para matapos na. Let's call on Ma'am Lane again. Lane Arandia.
Okay, number 46. Which of the following is the best prescription for treating a patient who complains of chills, fever, headache, soreness, and pain in the limbs, nasal obstruction, running nose, cough, no sweating, profuse sputum, a thin white coating, and a superficial and tense pulse?
Answer.
Ito pong Leches.
No, Lieche.
Lieche 7. Ito pong letter
Huwag mo
C
na
po.
i-pronounce yung Chinese, baka magmali pa tayo.
GB20.
Meron tayong CA sa lab na marunong yan. Ang hirap
Letter
kaya.
C po, Doc.
Okay, bakit ka gumamit ng Phlegm, bladder 12?
Ang bladder 12 po kasi,
may napansin ka, may mga Phlegm is wind, F-E-N-G. Gallbladder 20, yan yung wind pool, diba? Ang Phlegm naman, wind gate. So, pang-alis ng wind. Li4, ini-eliminate din niya yung wind. Okay, very good. So, lang 7. Next, Ma'am Lee.
Apo.
Para matapos na.
Number 47, which of the following points is the best selection for treating asthma of the wind-cold type? Ito pong letter A po, Doc. Bladder 12.
Okay, bladder 12. That's bladder 12. Next, 48.
48. Which of the following points is the best selection for treating diarrhea caused by the deficiency of kidney yang? Ito pong pag may kidney yang, dito po siya sa Mingmen, sa Mingmen po siya, sa kidney po, Doc.
Saan po ang
Letter
location
C.
ng Mingmen?
Nasa likuran po siya ng sa lower border of the second lumbar vertebra.
Yeah, second lumbar. Below the spinous process of lumbar 2, second lumbar. So, pag pinatayo mo yung pasyente, asan siya opposite?
Sa navel po.
Ang galing. Okay. How are you going to needle para mawala yung hold? Upward or downward?
Downward. Downward po.
Ano ba nangyayari sa heat pag paakyat mo sa Dumi region? Di ba dapat kailangan mo ng heat dito? Di ba as you go up, so kailangan upward, di ba? Are you going to tonify or are you going to sedate?
Tonify po.
Very good. So upward. Let's go to number 49. Lapit na.
Number 49, a middle-aged patient has the following signs and symptoms: headache, painful joints, nasal obstruction, rhinorrhea, itching of the throat, cough, a thin expectoration, aversion to cold, a thin white tongue coating, and a superficial and tense pulse. The best prescription at this time is itong letter C po, Doc. GB20, bladder 12, SJ5.
So ito na yung aversion to cold. This is very, very exterior, di ba? So tanunggalin mo yung win, bladder 12, gallbladder 20, paulit-ulit lang. And also SJ5, it's very good for eliminating the win as well. Lalo na pag dampness. Okay? Number 50, the last one finally.
Number 50, a patient has the following signs and symptoms: fever, headache, yellow phlegm, dry mouth, sore throat, a thin yellow coating, and a superficial and a rapid pulse. The best prescription for him is ito pong may letter B, lung 5, lung 11, LI4, lung 10, tsaka po yung SJ5.
Okay. Ano yung ano dito para malaman natin na superficial and rapid pulse, no? So, sore throat. Okay. Alam niyo na to. Thin yellow tongue coating. Paulit-ulit lang yung points, di ba? Anyway, binigyan ko lang kayo ng taste of what's supposed to come. This will probably be more detail for module 3. So expect a lot of points. Are you all ready for the challenge? Okay. So thank you, Paul, for joining us. Do we have any questions before we call it a night? It's getting late. Did you all have a great time tonight? Ay, walang
Yes
nag-yes.
po, Doc.
Okay.
Doc, thank you po, Doc.
Maraming salamat. Don't be offended pag mali yung sagot nyo or lalo na pag mali yung pag-support nyo ang answer nyo, no? So dito po kasi sa lab, even if you answered it correctly, you have to tell us why the other options are wrong. So we are now on our 14th week and you're still strong for the 15th. Are you excited for the next week? Wala na tong wala na atrasan. We will run for 60 weeks. Excited? Marami na ba kayo natutunan?
Super dami na, Doc.
Yes, Doc.
Parami na po ng parami.
Hindi ba? Ang hirap pa pala nito. O hindi, hindi naman. Okay, yung mga yeah. So if you want to view all of our past videos, especially those, umpisa po kayo sa 1, yung TCM Foundations Review. So someday you will see yourself like, ay, ang galing ko pala talaga. So dito, again, it's not simply knowing the right answer. It's also about justifying your answer and explaining why all the other answers are wrong. Okay? Hirap na po. Yun naman. So sige, tuloy-tuloy tayo. Ganito gagawin ko. We'll come up with videos with a required number of hours para medyo madali, no? And we will continue habang kaya natin hanggang sa malaman ng mundo na magagaling kayo. Okay, maraming salamat po. If there are no questions, we would like to thank everyone for joining. So excited for next week. Congratulations, you have survived 14 weeks. Okay, do you have any questions, Sir AK?
Wala naman, Doc.
May gusto kang sabihin eh. Hindi ba kayo nahihirapan? Pagdating ng week 40, 50, you'll be so confident. And by the way, we will be scheduling your practical maybe end of July or 3rd week of July. We'll let you know. Okay? Tinan ko, ipo-pattern ko. Gusto ko kasi yung kasama na lahat eh. Para maisa na lang. Para pati yung points. No? So, for those who enrolled in our CAA program, if you join our practicum, it is not simply needling the point. You have to tell a story about the point. How do you tell a story? First, you need to tell us the exact location. Second, you need to classify the point. Ano ba to siya? Tutsi point? Is it a luo connecting point? Is it a back shoe? Ganon. Third, you have to tell us the functions. Kasi pag hindi mo alam yung functions, para lang tayong naglolokohan. It's just like an MD that describes so many medications kasi hindi niya alam ano yung problema ng pasyente niya. So gagawin, tutusukin ka lahat. No? Okay. Ano pa ba? And of course, you need to know the combination. So, huwag kayong magsawa. This is how life should be as a practitioner. If we want to excel, you have to work really hard. So, thank you, everyone. Ma'am Annalyn, would you like to say anything? Can you survive another 35 weeks more? Nakamute, Ma'am Annalyn. You're muted. Please unmute.
Yes po, Doc.
Oh. Anything?
Ano po?
Kumusta po? Ano yung impression nyo? Do you like the way we're...
Very excited na magaling na. Maging
Ano ba?
PA.
Ganito,
Working very hard.
when you started the journey, like from 1 to 10, one as the weakest, 10 is ano, saan yung score mo when you started?
Sa performance natin.
Oo.
Ay, sa akin po laging 10. Kasi
Ay, wow,
kino-compare ko
talaga,
naman sa
grabe.
iba. Kino-compare ko, ang
Very
layo
good.
naman. Ang ganda ng quality.
Thank you, nakakataba ng puso. In fact, it will really inspire us more to give you more challenging questions. No? We want to be the best. We want to become global, right? So the future is bright. And don't worry about the quality of our lectures. No less than the president of PAI, Philippine Academy of Acupuncture, the head of our faculty. How else can we fail? So, tuloy-tuloy na yan. Bawal mabagsak, no? Kailangan yung highest score nyo is nobody should get a score lower than 9. No? You should be. O sige, sabihin na natin line of 8. Diyos ko naman, sa paulit-ulit. Hindi mo napansin yung mga question, paulit-ulit. Pati ako nabibiginan lang, no? Oh. Okay, let's call on. Maraming salamat sa iyong comment, Ma'am Annalyn. Let's call on 2 more. Ma'am Darlene of Okada. How are we so far?
Doc,
How are we doing so far?
very well, Doc. The way you teach, life is very transforming for me. Kasi napupush ako. So, busy sa work talagang in the last few weeks talagang nag-exert ako to get it.
Halata naman eh. You know, in Okada, most of your clients there are very, you know, I think they should get value for their money. You don't
Yes,
have to tell us how much it costs, but we're going to visit you tomorrow. It's okay. We won't. They wouldn't mind paying more if they see quality. So, I want all of you to master the art of diagnosis. You don't have the right to needle if you do not know how to diagnose. No? And when I say diagnose, both the Western and Chinese. Yun na po ang requirement ngayon ng TikTok. Excited? So,
Super excited, Doc.
yeah. So we're going to give you I have many books, e-books lang. And alam nyo, mabait talaga yung Diyos. Para nagbibigay ka pala. You know, there was one attendee here Wednesday. Sabi niya, you need books? Oo naman. Para kami nga. he will donate books daw, e-books. So expect. Kaya lang, ewan ko lang kung binabasa niyo yung e-books. Anyway, use them as reference. Maraming salamat po, Ma'am Darlene. Malaking bagay
Thank
po
you
yan.
po, Doc.
Hindi po tayo mapapagod. Sana po hindi bumigay yung ating puso and love. And let's call on Sir AK na mukhang natulog na yata. Okay.
So,
any comments, Sir AK? How are we doing so far?
sa akin, Doc, masaya po kasi mas maganda yung ganitong sistema, Doc, kahit yung paulit-ulit siya, Doc, mas nare-retain yung knowledge, lalo na sa diagnosing, Doc, napaka-halaga po talaga nito
Yeah.
Para sa isang acupuncturist talagang andito ang buhay hindi sa tusok.
Kasi sa points kasi kahit mali, okay lang, di ba? Alam mo, pag may confidence ka, nararamdaman ng client yan sasabihin ng client, nagtatransmit yan sa client. And your client will like you for it. Kahit mali yung points mo. They wouldn't mind. Anything else, Sir AK?
Wala naman, Doc.
Okay. Maraming salamat po sa lahat.
Thank you, Doc.
Matulog po kayo ng mahimbing. Yung mga iba na malapit lang dito sa lab, we hope to see you tomorrow. Sleep tight. And let's discuss first before we gusto namin maging uniform tayo. We have to have a trademark. We have to have what's this? We have to standardize everything so that we will all be ready for the international convention in 2027. Call me hallucinating, but we'll make that dream come true. That was the wish of the late Dr. Palanca. No? Sa tingin ko naman, at the rate we're going, hindi po yan imposible. Okay? 2027 or 2028. Basta kaya natin yan. So maraming salamat po sa tiwala. And once a week naman tayo nagaganito, di ba? So siguro I'll try my best to really come up with videos that will comply with the requirements of PPAP, via YouTube. So please find time to watch it. And you will expect changes with the way we do assessment. Maraming salamat po. Ang plano ko kasi sana kung pwede, just give you questions. Then you tell us about it because I want you to get used to answering questions. So I hope you don't get offended when I try to make moodle sometimes, but that's the way life should be. Diba? So, kasi kung magaling ka, hindi ka maapektuhan ng moodle. Diba? So maraming salamat po, especially those who just zoomed in. Thank you so much. We do this every Friday. Okay, so good night, everyone. Maraming salamat po.
Good night, Doc.
Good night.
Good night, classmates.
Ingat po. Bye.
Good night.
Don't forget on Monday, Tuesday, Wednesday. Bye.